Hello, I hope that you're doing well. Welcome back to Liz&Peps Productions, and this is special edition Health Series by Liz. And so, welcome to Health Series by Liz, your destination for wellness and vitality. And so, today we are going to talk about a topic that affects many men, and that is prostate cancer. Did you know that prostate cancer is the most second common type of cancer in men worldwide? I'm not sure whether you knew it or not, but yeah, there you go. And so this statistic actually underscores the critical need for awareness and understanding of prostate cancer amongst the men and also women, given that women are also in the background looking after them as well. It could be in form of wives or daughters. It really doesn't matter, to be honest. And so in this video, we are going to be providing a comprehensive information about prostate cancer, and that's going to include really what it is, its risk factors, its symptoms, diagnosis, treatment options, and actually how you could go about preventing prostate cancer. Our goal is actually to empower you with knowledge to provide proactive steps in your health journey, whether you're looking to understand about prostate cancer really for you or for other people, really a loved one, really. And so this video, we will be providing valuable insights, and so stay tuned as we break down everything you need to know about prostate cancer. So just to kickstart, and so prostate cancer is a type of cancer which actually affects the prostate glands, and the prostate gland is actually in the male reproductive system, and its work is to produce the seminal fluid. I'm not sure whether I got that pronunciation right there, to be honest, but yeah. So prostate cancer, it's actually one of the most common types of cancer in men, and particularly for those who are aged 50 years and above. What happens is that the prostate gland is located right below the bladder, and it is in front of the rectum, and it is actually the main function of the prostate is to help to produce and to transport the sperm. And so there are different types of prostate cancers, really, but the most common type is the adenocarcinoma, which normally originates from the gland cells. So while some of the prostate cancers normally grow slowly and may need minimal or no treatment whatsoever, others can be very aggressive and really spread quickly to the other parts of the body other than the prostate. Understanding the basics of prostate cancer, including how it actually develops and the role that the prostate gland plays, is the first step to recognizing the importance of early detection and treatment of prostate cancer. And so in the next section, really, we are going to discuss about and delve deeper into the factors and symptoms, risk factors and symptoms of prostate cancer. And so just to kickstart, several risk factors can include age is one of those key factors, and the older you grow, then the more susceptible you are actually to developing prostate cancer. And so for people who are 50 years and above, they're actually more susceptible to actually developing this diagnosis, they're more susceptible, to getting this diagnosis. Other than age, another predisposing factor is the family history. And so if you have a brother or your father really who's been diagnosed with prostate cancer, then your likelihood of also getting this diagnosis is also increased. However, just to also let it out that different studies have actually shown that yes, as much as genetics can be a predisposing factors really to most of the medical conditions, if at all you modify your diet, then it normally decreases your likelihood of developing these different types of conditions. And so cancer is definitely not ruled out. It's definitely not exempted. And so given that, yes, you probably have some family members who've had this diagnosis, it does not really mean that you must have it at the end of the day. Then the other thing is ethnicity, and so men who are of the African American race are actually more susceptible as well to developing prostate cancer as opposed to those who are of the other races as well. And additionally, lifestyle factors, and by this we're talking about diet that I just mentioned a couple of minutes ago, as well as obesity, which is sort of tied to really diet, because it's more of nutrition status, isn't it? So those are some of the factors that could actually predispose one to developing prostate cancer. By understanding the risk factors, men can take proactive steps to monitor their health and also to engage in preventive measures. And so in the next section, we then now get into the symptoms of prostate cancer. What does it look like? What would actually present so that you could know whether you are actually developing it or you need to actually get concerned? And so here are the things. So prostate cancer normally manifests in a variety of symptoms, particularly as it progresses. And so when it is just kicking off, most of the times there are no symptoms, and that is why regular screening are vital when symptoms do appear. However, the common symptoms normally would be, for instance, difficulty in urinating, a weak or interrupted urine flow as well, and frequent urination, and especially this is at night. Men might also experience pain or burning sensation during urination as the cancer normally advances and as the cancer cells continue to spread throughout to spread really and multiply, metastasize. Additionally, symptoms may also arise such as blood in the urine or semen, painful ejaculation as well, and persistent pain in the back, hip, or pelvis. These symptoms normally indicate that the cancer may have spread beyond the prostate, and at times for some people it could also present in terms of fatigue and weight loss in more advanced stages really. And so recognizing these symptoms early is very crucial because it can actually lead to timely diagnosis of the prostate cancer, and treatment can actually be started really early to prevent it from spreading really to the other parts of the body. And so now we get to talk about the diagnosis of the prostate cancer. We've talked about the symptoms, we've talked about what really it is, and so now how is it normally diagnosed? So normally the diagnosis is typically involves several steps to confirm the presence of cancer and also to determine its stage. The initial screening often include a prostate-specific antigen blood test, and that is a PSA, as mostly abbreviated. Elevated PSA levels would normally indicate that there is prostate cancer, though they can also result from other possible things really. So it doesn't really mean that if you have elevated PSA, then that's sort of that's prostate cancer really, and that's it. Other things really would normally contribute to the higher levels of PSA as well, and that is why even after getting that high, the raised PSA levels in a blood test, then there would be other things that would be happening after that. Another common screening method is the digital rectum examination, and so you'd probably have had a DRE, yes, digital rectal examination, and this is whereby a healthcare provider manually checks the prostate for any abnormalities. And if this screening suggests any potential cancer, then further diagnostic tests are normally done, and this include a biopsy of the prostate. Staging the cancer, which involves determining whether it has spread and how far, is critical for planning the appropriate treatment, and early and accurate diagnosis is key for effective management and better outcomes. Next, we will be discussing about the various treatment options available for treating prostate cancer, and this normally depends on the stage and aggressiveness of the disease, as well as the patient's overall health and preferences. For early stage prostate cancer, active surveillance or watchful waiting may be recommended, and this would normally involve regular monitoring without any immediate intervention. Surgery such as prostatectomy, which normally involves the removal of the prostate glands, is often considered for localized cancer, and radiation therapy, which uses high energy rays, can also be used, and this normally targets and kills the cancer, and this can be delivered either externally or internally. There is also hormonal therapy, which aims at reducing the levels of the hormones, which can actually fuel the cancer growth in men, whereas chemotherapy uses drugs to destroy the cancer cells, and typically it is for advanced prostate cancer. That's when it actually can be used. So there are also newer treatments which have been brought on board, and this is for instance, immunotherapy and targeted therapy. And these options normally are designed to boost the immune system or target the specific cancer cells. Each treatment has potential side effects. Shall we now go into the preventive measures then? How can we really prevent prostate cancer? Early detection is very important, making lifestyle changes and staying vigilant. A healthy diet, which is rich in fruits and vegetables and whole grains, while reducing meat and high fat intake, really can lower the risk. There's a saying that goes garbage in, garbage out, and that's normally in IT, and that normally also definitely applies to whatever we eat. So if you're having lots of garbage going into your gut, going into your system, really, you're going to reproduce it. So diet is very important in the management of any condition, that's for sure. Regular physical activity also helps to maintain a healthy weight, and given that obesity is actually a risk factor for prostate cancer, then it's quite important that we keep the weight in check. Men over 50 years or those with a higher risk factors such as family history or African American ethnicity should discuss prostate cancer screening with their healthcare providers, and counseling can be beneficial for such men with family history of prostate cancer, helping them to understand the risk and take proactive steps to actually incorporate these preventive measures. And staying informed about screening options is very key. Men can significantly improve in their chances of developing prostate cancer by early detection and effective treatment. Understanding prostate cancer is crucial for early detection and effective treatment. We've covered the basics of prostate cancer, including its definition, risk factors, symptoms, diagnosis, treatment options, and even the prevention strategies. Thank you for watching today's video on Liz&Peps Productions. If you found this content valuable and want to see more of health series, kindly just let me know really on the comment section. And also please don't forget to subscribe on our channel by clicking on the button below it and subscribe. So until next time, you take care and stay healthy.